We have this is a needle loading device. The seeds itself come in a magazine. Hold on, I'll take it off for you. The radioactive seeds are in this magazine, and they're like in curls. And they come out here at the very end. So you put the magazine into this machine. You put the needle on here. Yeah? Once you have the magazine, and then you push the needles in the seeds into the needle, and you take the needle off, and then you put the styrofoam. Now it's finished. Yeah? So we'll get another magazine, and then we can show you how the needle loading is being done.
If you treat a prostate cancer patient with an early disease, you can treat him very well with either radical prostatectomy, external beam radiation, or brachytherapy. Over the last 25 years, we've treated many patients with early disease, and the likelihood that they get cured with the brachytherapy of their cancer is way above 90%. So, depending on the PSA, depending on the Gleason score, the aggressiveness of the tumor, depending on the size of the tumor. If you find the tumor early, the likelihood that the patient survives the next 15 years and not die of prostate cancer is above 98%. If you compare the patients in Europe to the patients in Kenya, we've been coming here since 2017, and we've seen a change in the diagnosis of the patients. In 2017, most of the patients were diagnosed too late. They had a high PSA, they were coming in when they had symptoms, which usually is that they have an advanced tumor and they cannot be cured. It's a palliative treatment. And since then we've been coming back, and we've seen that the screening has become more efficient in Kenya, and we find that most of the patients we see nowadays are early tumors. And those early tumor patients can be treated well with brachytherapy. Very effective. And from the start in 2017 until then, more than 100 patients have been done here, and the technique increased significantly. The quality of the technique increased significantly. The number of patients that we treated per year increased significantly because better diagnosis. We have been training brachytherapy centers for the last 20 years, and we've been trained about 100 different centers in more than 10 different countries, and Kenya is the only country in sub-Saharan that we've been training. Most centers we did in Italy and Switzerland, Austria, and in other European countries, then going into the Baltic states and Russia. But the Nairobi Hospital approached us in 2016, and they wanted to learn the technique, and they came over to see us in Berlin, get some training in our side, do some theoretical training, do some practical training, and then they invited us to come here to start the program going together here.
The biggest difference is, one, the time it takes to get you treated.
In terms of
As in, you need to be admitted for a number of days. In this case, you need just 1 day's admission. Mm-hmm. Two, the surgery is always very invasive. There is no way you're going to reach the prostate without cutting you. Whether you're going to cut using even the best methods, you've heard of the robotic approaches where you can go with a robot, get inside the body, you're still going to cut the prostate out. There are structures you're going to remove permanently, like the seminovesicles and the tubes that carry sperms, the vasti. You remove those ones at radical surgery. So that removes the possibility of children completely and reduces ejaculation. While at radiotherapy, the other types of radiotherapy, you damage those tubes permanently, but you may have the possibility of producing children. But for brachytherapy, the injury to those tissues is minimal. The injury to the other tissues, which is why we said we've had very little side effect, the injury to the rectum, the injury to the bladder, the injury to the bones, and even bowel is minimal with this treatment, which does not radiate things which are more than 2 to 3 centimeters away from it.
I'm one person who is always very keen on my health. So I do regular body checkups, and which I highly recommend that if you are able, this is an exercise that you should do at least once a year. Because what I can say is that no one is safe from such an occurrence. So I started checking my PSA, I think 4 years back, and every year I've been checking. And then sometimes last year I realized that my PSA has started rising slightly. So I engaged my urologist, who is Professor Mungai, and so we started doing an investigation of what would be happening in me. And then first we suspected prostatitis, that is it's supposed to be an infection. He put me on antibiotics for, I think for a bigger part of last year. And sometimes it would go down, sometimes it would rise. So this triggered a concern that maybe we needed to do further tests. So I went for an MRI, and but nothing was seen. I did 2 MRIs. Actually, I did 2 MRIs. I did one this year and I did sometime last year. Both MRIs were negative. Nothing was actually seen. So Prof suggested that I do a PET scan, which I did early this year. This was in June. And the PET scan was not very clear either that something exists. So the worries remained there because the PSA still was not behaving, because it's supposed to be maximum of 4, and mine was reading 9. It went up to a high of 9.1. So the specialists who were doing the PET scan suggested that we do a biopsy just to be sure that there's nothing. So in July, I visited here, Nairobi Hospital, and biopsy was done by Professor Mungai, and I think he took so many samples, lots of samples. He took, if I'm not wrong, it was about 100 of them, because I know Prof is, for it to be, because it was, if it was there, and as we highly suspected, then so many samples have to be taken. So Prof took a lot of samples. So out of the samples that he took, I think 6 of them turned to be having a trace of cancer cells. So Prof told me I don't need to worry, because at that stage there is a treatment that is called brachytherapy, and apparently what I know is that it's only offered at the Nairobi Hospital by Prof and his team. So, and I was lucky because as he was conducting it, there are some specialists who came from Germany, because I understand that is where it originates from. So they were also here. So I want to say that this was really a good opportunity, because if the specialists from where it originates were also here, then it gave me a lot of confidence. Although I understand and I know that Prof has conducted this not once, not twice, and there's a success rate. So yesterday I went in. I went in yesterday at around 3 p.m. and to be very honest, I can't say what happened, because they put you under anesthesia. And when I woke up, everything was just normal. I didn't feel anything until now. As you see me here, there's nothing that I feel nothing. There's nothing. I cannot say that it's painful or everything is fine, because I'm passing urine just okay. My body is just fine. I've had my breakfast very well. and I'm just waiting to go home.